Ako, if they turn out positive, I usually depend lang kung ano yung nararamdaman nila. But of course, you can get a CBC, you can get an X-ray, no? Yun, those are the two most basic tests. Then ako, it depends on the, let's say, the patient has some shortness of breath, then maybe I would request for other tests as well. Pero those two basic tests, aside from the COVID-19 RT-PCR, are the X-ray and CBC.
Thank you po. And finally, another question po, paano po ba yung, kasi nauuso rin to I think a lot of people kumukuha na rin ng sariling oximeter. Paano po ba yung tamang pagbasa? And may tips po ba kayo, what is the truth behind the numbers na lumalabas dito?
Okay. The oxygen pulse oximeter is actually a very good device. No? It's easy to use. All you need to do is i-relax yung kamay mo, tapos make sure it's below the heart. Tapos, kumbaga dapat hindi siya malamig kasi pag malamig medyo mas masikip yung daloy ng dugo. So, you just put it dun sa may ano mo, sa fingers mo, nakatapat yung ilaw dun sa yung kung saan yung reading mo nababasa, yun yung normally yun naka-point up, no? So, you put it there for a few seconds, 2 minutes, hanggang makuha mo yung reading. Now, patients with a normal lung function, ang usual niyan is the normal for it is about 95% and above, no? But of course, for some people na may, let's say, may even without COVID, may some form of lung disease like asthma, COPD, or other diseases ng lungs, pwedeng mas mababa ng konti doon, no? So, yun po ang ginagamit naming guide. No, so I tell my patients na if your oxygen saturation is less than 92, chances are you would need to be in a hospital, or you would need at least oxygen support at home if you can get one.
Okay. Doc, yung tanong ko lang for both of you, Doc Paul and Doc Angelo, yung in the case of my husband, he had an RC, a swab test, no? And nag-positive siya, so he had an X-ray. But hindi niya nagawa yung blood tests. So dapat may blood test. Yun yung gusto ko i-clarify with you, no? Kasi ibang doctor yung kausap niya at first, and of course we were saying na mild lang, etc. Kailangan ba yun? Set ba yun dapat, Doc? So X-ray and blood tests, magkapatid lagi yun before you even decide if it's home care or hospital. Doc Angelo?
Ako, for me, actually, not necessary. Hindi yun ang ginagamit kong basis for hospital or home care. Of course, kung makita mo the X-ray, makapal talaga, or yung involvement ng lungs, no, with an X-ray is very extensive, then that's probably the exception. But kung merong mang marka, but the patient is doing well, yun nga. Sometimes I get a lot of patients, no, for home care that they have pneumonia on their X-ray, but they're doing well. They have a low-grade fever, or yung iba nga, pag dumating sa akin, wala nang lagnat for a few days, and their oxygen saturations are okay. They don't have difficulty of breathing. They don't have shortness of breath. Well, I just tell them, stay at home ka na. It's more of how the patient is that makes me decide whether I advise admission or not. But of course, yun nga, exception is if I get a really bad X-ray na tingin mo it will progress, eventually mararamdaman niya to, then I would suggest hospital admission right away. And of course, kung merong underlying illness, no, that can get more difficult later on, I advise them to be admitted as well.
So Doc, so ang una ay swab test and then X-ray. Tapos ano na, monitoring, clinical presentation,
Yes,
no?
Yes.
Okay. Doc Paul, ito po may questions dito. Oh, you wanna add to that, Doc Paul?
Well, pagka pinapaliwanag ko yan, hinahalin tulad ko sila sa balita ng Pag-asa. Kasi ang basically, ang sinasabi nila pagka meron kang COVID, ang hinihintay mo kasi dyan or iniiwasan mo yung inflammatory storm, cytokine storm. Kaya ron siguro mo tinatanong yung mga blood exam mo. Now, ang sasabihin mo kasi dyan, para kang sa Pag-asa, nasan ba sila nagsisimula? Sa west. Sa east pala, sa Pacific Ocean natin. Nakikita yan ng Pag-asa na merong namumuong low pressure area. Malayo pa, several kilometers, hundreds of kilometers from the Philippines. Now, from there, titingnan mo ngayon yung inflammatory storms, yung cytokine levels mo or inflammatory markers mo. So, roon mo makikita. Now, pagka meron ka ng mga criteria, set of criteria, roon mo sila dapat bibigyan ng gamot. But basically, kung tatanungin mo ako kung anong pinakasimpleng guide para malaman mo kung kailangan mo i-admit, meron ka rin tinatawag kasi na happy hypoxemia or silent hypoxemia. So, ang pinakasimple talaga would I feel really be your pulse oximeter. So, ang ginagamit kong level dyan is 94 and above. You should be more or less okay. 93 and below, medyo danger sign na yan. So yun ang mga dapat na babantayan mo.
Doc, ano lang, mabilis lang, para lang yung technical term, the cytokine storm, maintindihan lang ng mga tao. And then, also to differentiate, Doc, kasi di ba yung pulse oximeter, ang sinasabi nga, and again, kayo po yung magpaliwanag, iba pa rin yung blood test, which will measure the real amount of oxygen in the blood compared to an oximeter.
Yes, well, definitely. Kaya lang ang problema mo dyan, when you request for a blood test at home, kailangan mong katawagan ng emergency room or ang laboratory, hello, dadating ako. Kasi hindi ka nalang basta-basta pwedeng pupunta na lang sa laboratory without announcing yourself because you put other people at fault. Yun na nga yung sinasabi namin, inflammatory markers, CRP, marami yan eh. That's highly technical terms. So, hindi lang yan nakukuha sa CBC, but marami yan.
And when do you take that, Doc?
We take a baseline and then we monitor that siguro every 3 days. Depende.
Okay. So, yung x-ray, pag nag-x-ray ka, ideally ba kasama sana yun? Or kailan papasok yun?
You take it clinically kasi, Jing eh. Hindi mo talaga mabibigyan siya ng set number of
automatic.
Hindi siya automatic.
Okay.
You take it kasi mahal din yon. It will cost, it will be a burden to the patient's finances. So, hindi rin naman pwede na automatic routine siya. So, you base it on clinical grounds.
Okay, kaya binabanggit nyo yung oximeter would still
Yes. Well, yun ang pinakasimple natin. At sa bahay, alam ko. But mag-ingat rin kayo. You need to check for the battery status, and you need, marami ka rin, magkakaroon ka rin ng problema dyan eh. But yes, I feel kung sa bahay lang kasi, and I need to warn everybody in fairness, while marami, lalo na nung surge, maraming naho-hospital, I also need to tell everybody that according to the statistics of the DOH, 93 to 96% are asymptomatic to mildly symptomatic. While marami ang na-admit sa hospital, especially during the time of surge, mas marami pa rin ang pwede mong ma-manage sa bahay. So, palagay ko rin muna tayo dapat hindi lahat ng COVID pwedeng i-admit, lalo na pagka ganyan. But totoo rin naman yon na marami na rin akong pasyente na hindi umaabot sa hospital.